Hello, my name is Trinidad, and this is my Teach Me project on the first lab. So to begin with, we have extension, which is increasing the angle between origin and insertion. Next, we have flexion. This decreases the angle between the origin and the insertion. Next, this is hyperextension. Hyperextension is extension beyond the anatomical position. This here is abduction. A way that I remember is the arm is being abducted away from the body. Next is adduction, which is medial movement of the limb towards the midline. Now we have the rotational motion, which is the bone turns on its own long axis. This would be C1 and C2. Next here we have lateral rotation, which is limb rotates away from the midline. And here is medial rotation, which is the limb rotating towards the midline. Next, we have circumduction, which is a circular motion, and this one is pretty easy to remember. Now we have protraction, which is the anterior movement of the body part. And here the example is sticking the jaw, also known as the mandible, forward. And the opposite to that is retraction, which is the posterior movement of the body part. And this would be retracting the mandible backwards. And the way I remember protraction is you punch to protract. Now we have elevation, and this is a superior movement of a body part. And next we have depression, which is the inferior movement of the body part, which would be bringing the shoulder downward. So the next type of movement we have is pronation. And pronation is a medial rotation of the forearm, and it is when the palm is facing posterior. One way to remember is with prom, when you take a picture of the girl's hand with the corsage in her hand. Next we have supination, and this is the lateral rotation of the forearm, and the palms are facing anteriorly. Now we will move on to dorsiflexion, which is the movement to point the toe superiorly. And a way to remember this is by dorsal fin, because it looks like a dolphin's dorsal fin. Next, we have plantar flexion, and that is the movement to point the toes inferiorly. And now for the last two types of movements, we have inversion, which is the soles of the feet turning medially, and eversion, which is the soles of the feet turning laterally. My model wasn't cooperating, but you guys get the point. Now we will be moving on to the major surface landmarks, starting off with the glabella, and that is the spot between the eyebrows. After that, we have the bridge of the nose, and the bridge of the nose is the spot of the nose between the eyes. Following down would be the dorsum of the nose. Here is the middle line region of the nose. Next is the ala of the nose, and the way to remember this is because ala in Spanish is wing, so they kind of look like two wings. And the easiest one would be the nostrils, which are the holes in the nose, and I'm pretty sure we all know those two. And the philtrum. The philtrum is the ridge between your nose and your upper lip. Next, we have the lateral major surface landmarks, starting with the auricle, which is the entire outer ear. And next, we have the helix, which is the ridge of the outside of the ear. And that is the entire border there. Next, we have the tragus, and that is this little flap, which is made of elastic cartilage and is on the anterior part of the ear. And lastly, we have the earlobe, which is typically where the piercings go. Okay, now Here we have the thyroid cartilage, which is also known as the Adam's apple, which is located superior to the thyroid. After, we have the jugular notch, and that is right above the manubrium of the sternum, and that is between the two clavicles. Now we have the nipple, and that is pretty easy to identify, and the areola. Next, we have the costal margin, and that is the inferior edge of the rib cage. Okay, here we have the umbilicus, which is known as the belly button. And a way to remember this is the umbilical cord, which is cut during delivery. Next, we have the inguinal region, and this is the region between the thigh and the pelvis. Okay, in the last few landmarks, starting off, we have the gluteal cleft, and that is the butt crack, and that's kind of easy based off its name. Next is the popliteal, and that is the back of the knee, at this region there. And lastly, we have the perineum, which is the space between the genitals and the anus, which is just blank space. Well, that pretty much covers all of Lab 8, which was the introduction to the muscles. Good luck on this practicum.